Question 91. Which of the following lab values is associated with a decreased risk of cardiovascular disease? A. High HDL cholesterol. B. Low HDL cholesterol. C. Low total cholesterol. D. Low triglycerides. Answer A. Explanation. High HDL cholesterol and low LDL cholesterol are associated with a decreased risk of cardiovascular disease, reduction of risk potential. Question 92. When making an occupied bed, it is important for the nurse to A. Keep the bed in the low position. B. Use a bath blanket or top sheet for warmth and privacy. C. Constantly keep rise side rails raised on both sides. D. Move back and forth from one side to the other when adjusting the linens. Answer B. Explanation. Using a bath blanket or top sheet keeps the client warm and provides privacy. Keeping the bed in the low position and working above raised side rails might strain the nurse's back. Continually moving back and forth to tuck and arrange linen is time-consuming and is disorganized. Basic care and comfort. Question 93. When a client informs the nurse that he is experiencing hypoglycemia, the nurse provides immediate intervention by providing A. 1 commercially prepared glucose tablet, B. 2 hot candies, C. 4 to 6 ounces of fruit juice with 1 teaspoon of sugar added, D. 2 to 3 teaspoons of honey. Answer D. Explanation. The usual recommendation for treatment of hypoglycemia is 1,015 grams of a fast-acting simple carbohydrate orally if the client is conscious and able to swallow. For example, 34 commercially prepared glucose tablets or 46 ounces of fruit juice. It is not necessary to add sugar to juice, even if it is labeled as unsweetened juice, because the fruit sugar in juice contains enough simple carbohydrate to raise blood glucose level. Addition of sugar might result in a sharp rise in blood sugar that could last for several hours. Physiological adaptation. Question 94. A client is having a seizure. His blood oxygen saturation drops from 92% to 82%. What should the nurse do first? A. Open the airway. B. Administer oxygen. C. Suction the client. D. Check for breathing. Answer A. Explanation. The nurse needs to open the airway first when the oxygen saturation drops. The other actions might be appropriate, but the airway must be patent. Reduction of risk potential. Question 95. To remove a client's gown when she has an intravenous line, the nurse should A. Temporarily disconnect the intravenous tubing at a point close to the client and thread it through the gown. B. Cut the gown with scissors. C. Thread the bag and tubing through the gown sleeve, keeping the line intact. D. Temporarily disconnect the tubing from the intravenous container and thread it through the gown. Answer C. Explanation. Threading the bag and tubing through the gown sleeve keeps the system intact. Opening an intravenous line causes a break in the sterile system and introduces the potential for infection. Cutting a gown off is not an alternative except in an emergency. IV gowns, which open along sleeves, are widely available. Basic care and comfort. Question 96. Which of the following is most likely to impact the body image of an infant newly diagnosed with hemophilia? A. Immobility. B. Altered growth and development. C. Hemathriosis. D. Altered family processes. Answer D. Explanation. Altered family processes is a potential nursing diagnosis for the family and client with a new diagnosis of hemophilia. Infants are aware of how their caregivers respond to their needs. Stresses can have an immediate impact on the infant's development of trust and how others relate to them because of their diagnosis. The long-term effects of hemophilia can include problems related to immobility. Altered growth and development could not have developed in a newly diagnosed client. Hemathrossis is acute bleeding into a joint space that is characteristic of hemophilia. It does not have an immediate effect on the body image of a newly diagnosed hemophilia. Health promotion and maintenance. Question 97. Which of the following values should the nurse monitor closely while client is on total parenteral nutrition? A. Calcium, B. Magnesium, C. Glucose, D. Cholesterol. Answer C. Explanation. Glucose is monitored closely when a client is on a total parenteral nutrition due to high glucose concentration in the solutions. The other values are not monitored as closely. Health promotion and maintenance. Question 98. A client with stress incontinence should be advised: A. To purchase absorbent undergarments, B. That Kegel exercises might help, C. That effective surgical treatments are non-existent, D. That behavioral therapy is ineffective. Answer B. Explanation. Kegel exercises tightening and releasing the pelvic floor muscles might improve stress incontinence. Choice 1 is not an appropriate treatment for stress incontinence. Several effective surgical treatments exist. Lifestyle and dietary modifications can also be helpful. Physiological adaptation. Question 99. Diagnostic genetic counseling for procedures such as amniocentesis and chorionic villus sampling allows clients to make all of the following choices except: A. Terminating the pregnancy, B. Preparing for the birth of a child with special needs, C. Assessing support services before the birth, D. Completing the grieving process before the birth. Answer D. Explanation. If findings are ominous, the grieving process will not be completed before birth. If the couple elects to terminate a pregnancy based on diagnostic tests, there will be grief and concerns for future pregnancies. Couples might choose to assess support services and prepare for the birth of an infant with special needs. Some fetal conditions can be treated in utero. Health promotion and maintenance. Question 100. A client who is experiencing infertility says to the nurse, "I feel will be incomplete as a man, woman if I cannot have a child." Which of the following nursing diagnosis is likely to be appropriate for this client? A. Risk for self-harm, B. Body image disturbance, C. Ineffective role performance, D. Powerlessness. Answer B. Explanation. Of the nursing diagnosis listed, the client's statement most represents body image disturbance because it directly refers to loss of the function of having a child. Nothing in the statement indicates that the client is at risk for harming herself. Ineffective role performance could be correct, but is not the best choice because the statement does not reflect a disruption of the parent's role. Powerlessness could be an appropriate nursing diagnosis if the client described feeling powerless about the infertility. Health promotion and maintenance. Topic 2. Question set B. Question 101. An assessment of the scale of a normal 10-month-old baby should identify which of the following: A. Closure of the posterior fontanelle, B. Closure of the anterior fontanelle, C. Overlap of cranial bones, D. Ossification of the sutures. Answer A. Explanation. The posterior fontanelle should close by the age of 2 months. Health promotion and maintenance. Question 102. Attaching a restraint to a signed rail or other movable part of the bed can A. Do nothing to client. B. Insure the client if the rail or bed is moved. C. Help the client stay in the bed without falling out. D. Help the client with better posture. Answer B. Explanation. Attaching a restraint to a movable part of the bed can cause client injury if that part of the bed is moved before releasing restraints. Safety and infection control. Question 103. The chemotherapeutic DNA alkylating agents such as nitrogen mustards are effective because they A. Cross-link DNA strands with covalent bonds between alkyl groups on the drug and guanine bases on DNA. B. Have few, if any, side effects. C. Are used to treat multiple types of cancer. D. Are cell cycle specific agents. Answer A. Explanation. Alkylating agents are highly reactive chemicals that introduce alkyl radicals into biologically active molecules and thereby prevent their proper functioning, replication, and transcription. Choice 2 is incorrect because alkylating agents have numerous side effects including alopecia, nausea, vomiting, and myelosuppression. Choice 3 is incorrect because nitrogen mustards have a broad spectrum of activity against chronic lymphocytic leukemia, non-Hodgkin's lymphoma, and breast and ovarian cancer, but they are effective chemotherapeutic agents because of DNA cross-linkage. Choice 4 is incorrect because alkylating agents are non-cell cycle specific agents, pharmacological therapies. Question 104. Using cliches in therapeutic communication leads the client to what? A. Viewing the nurse as human. B. Accepting himself as human. C. Self-disclosing. D. Feeling discounted. Answer D. Explanation. The use of cliche in therapeutic communication is commonly construed by the client as the nurse's lack of understanding, involvement, and caring, so the client might feel demeaned and discounted. Psychosocial integrity. Question 105. Mrs. Patty is having difficulty falling asleep. Which of the following measures promote sleep? A. Exercising vigorously for 20 minutes each night beginning at 9:30 p.m. B. Taking a cool shower and drinking a hot cup of tea. C. Watching TV nightly until midnight. D. Getting a back rub and drinking a glass of warm milk. Answer D. Explanation. These are appropriate measures to promote sleep. Choices 1, 2, and 3 are all stimulation actions that increase arousal and wakefulness, basic care and comfort. Question 106. Ethical and moral issues concerning restraints include all of the following except A. Emotional impact on the client and family. B. Dignity of the client. C. Client's quality of life. D. Policies and procedures. Answer D. Explanation. Policies and procedures, too important, are not in the category of ethical and moral issues. The other options are ethical and moral issues, safety and infection control. Question 107. A client is told that his test is positive. In fact, the client does not have the disease tested for. What type of false report is this an example of? A. Positive. B. False positive. C. Negative. D. False negative. Answer B. Explanation. A false positive result occurs when the test result is labeled positive in error, when the actual result is negative. Safety infection control. Question 108. A nurse observes a client sitting alone and talking. When asked, the client reports that he is talking to the voices. The nurse's next action should be A. Touching the client to help him return to reality. B. Leaving the client alone until reality returns. C. Asking the client to describe what is happening. D. Telling client there is no voices. Answer C. Explanation. Nurses might observe behavioral cues that can indicate the presence of hallucinations. Talking about the hallucinations is reassuring and validating the client who has them. Focusing on the symptoms and asking about the hallucination helps the client gain control. Psychosocial integrity. Question 109. A client with massive chest and head injuries is admitted to the ICU from the emergency department. All of the following are true except A. The physician in charge of the case is the only person allowed to decide whether organ donation can occur. B. The client's legally responsible party may make the decision for organ donation for the donor if the client is unable to do so. C. The organ procurement organization makes the decision regarding which organs to harvest. Answer C. Explanation. The client's legally responsible party may make the decision for organ donation if the client is unable to do so. The donor or legally responsible party for the donor, the physician, and the organ procurement organization are all involved in the process regarding whether organ donation is appropriate for a specific donor. Coordinated care. Question 110. High uric acid levels can develop in clients who are receiving chemotherapy. This can be caused by A. The inability of the kidneys to excrete the drug metabolism. B. Acid bowel catabolism. C. Toxic effects of the prophylactic antibiotics that are given concurrently. D. The altered blood pH from the acid medium of the drugs. Answer B. Explanation. Chemotherapy causes damage to cells and uric acid is a cell metabolite. Physiological adaptation. Question 111. A nurse is planning a brief treatment program for a client who was raped. A realistic short-term goal is to A. Identify all psychosocial problems. B. Eliminate the client's enticing behaviors. C. Resolve feelings of trauma and fear. D. Verbalize feeling about the event. Answer D. Explanation. A realistic short-term goal is for the client to verbalize feelings about the event. A brief treatment program is not designed to identify or resolve problems. The focus is on managing acute symptoms. If an in-depth psychosocial problems are identified, the nurse might make referrals for treatment. Psychosocial integrity. Question 112. The vast majority of deaths resulting from unintentional poisoning occur in A. Infants, B. Toddlers, C. Teens, D. Adults. Answer B. Explanation. The vast majority of deaths resulting from unintentional poisoning occur in toddlers. Safety and infection control. Question 113. Common problems for supervisors include all the following except A. The supervisor facilitates development of staff members. B. The supervisor micromanages staff members. C. The supervisor wants to control the style in which a staff member correctly performs a task. D. The supervisor does not delegate. Answer A. Explanation. Facilitating the development of staff members is an important goal for a supervisor. Micromanagement, intolerance for individual differences in style, and inability to delegate or interfere with team building and overall effectiveness. Coordinated care. Question 114. The nurse is caring for a client who's dying. While assessing the client for signs of impending death, the nurse observes the client for A. Elevated blood pressure. B. Shiyin stopped respiration. C. Elevated pulse rate. D. Decreased temperature. Answer B. Explanation. She instructs respirations are rhythmic, waxing and waning of respirations from very deep breathing to very shallow breathing with periods of temporary apnea, often associated with cardiac failure. This can be a sign of impending death, psychosocial integrity. Question 115. A client with asthma develops respiratory acidosis. Based on this diagnosis, what should the nurse expect the client's serum potassium level to be? A. Normal. B. Elevated. C. Low. D. Unrelated to the pH. Answer B. Explanation. Hyperkalemia occurs in a state of acidosis because potassium no moves from injured cells into the bloodstream. Physiological adaptation. Question 116. The nurse should teach parents of small children that the most common type of first-degree burn is A. Scalding from hot bath water or spills. B. Contact with hot surfaces such as stoves and fireplaces. C. Contact with flammable liquids or gases resulting in flash burns. D. Sunburn from lack of protection and overexposure. Answer D. Explanation. The most common type of first-degree burn is sunburn, underscoring the need for education regarding the use of sunscreens and avoiding exposure, safety and infection control. Question 117. A 57-year-old woman is recently widowed. She states, I will never be able to learn how to manage the finances. My husband did all of that. Select the nurse response that could help raise the client's self-esteem. A. You feel inadequate because you have never learned to balance a checkbook. B. You should have insisted your husband teach you about the finances. C. You are strong and will learn how to manage your finances after a while. D. Why don't you take a class in basic finance from the local college? Answer C. Explanation. The nurse can raise the client's self-esteem by communicating confidence. The client can participate in actively finding solutions to the problem. The nurse also conveys the client is a worthwhile person by listening and accepting the client's feelings and praising the client for seeking assistance. Psychosocial integrity. Question 118. Following the change of shift report, the nurse should analyze the information and set priorities accordingly. When the plan has been formulated, at what point during the shift can or should the nurse's plan be altered or modified? A. Halfway through the shift. B. At the end of the shift before the nurse reports off. C. When needs changed. D. After the top priority tasks have been completed. Answer C. Explanation. The nurse changes the plan to respond to changes in needs. Coordinated care. Question 119. Signs of impaired breathing in infants and children include all of the following except A. Nasal flaring, B. Grunting, C. Seesaw breathing, D. Quivering lips. Answer D. Explanation. Lip quivering is a distractor. Signs of impaired breathing in infants and children include all the other options. Physiological adaptation. Question 120. On first meeting, a new nurse manager makes eye contact, smiles, initiates conversation about the previous work experience with nurses, and encourages active participation by nurses in the dialogue. Her behavior is an example of A. Aggressiveness, B. Passive aggressiveness, C. Passiveness, D. Assertiveness. Answer D. Explanation. The nurse manager is demonstrating assertive behavior. Aggressive behavior dominates or embarrasses. Passive behavior is nervous or timid. Passive-aggressive behavior is dominating or manipulative without directness. Coordinated care. Thank you for watching.